Daniel, my man, welcome to the show.
Boomer, thanks so much for having me. Great to be
So,
here.
you and I met originally in Helsinki, I think it was last November, had this fantastic conversation, then bounced on various parts of the world opposite to each other, and now we're finally having this call. So, thank you for all your patience.
No, likewise, made it eventually. So here I am in Tokyo, and there you are in the Netherlands, right?
Yeah, exactly. And I think the fact that you bring up Tokyo begs a lot of questions because your accent doesn't make you sound Japanese. And so, how did you end up in Tokyo of all places?
Yeah, it's a good question. We're technically an American company, run by Europeans, based in Tokyo with an Egyptian name. So go figure, right?
Yeah, that's
um,
that's a pretty exotic story right there.
so for my part, I was a language geek, I guess you could say, back in high school. I did some of the dead languages and then some French, and I wanted to try something completely new. I started learning Japanese and just found it very new and exciting and challenging. Um, I decided I wanted to be a lawyer. Um, and after practicing law, I found that was not what I wanted to be doing.
So,
So,
so mommy and daddy wanted a barrister, and you decided no.
well, I think now that things have kind of come around with the startup, they kind of got over it. But at first, they're like, you invest so much in this career, why would you change and so on. But during that time, I got very interested in business and I
Mhm.
wanted to create something. I wanted to try and do something new and exciting with my life. So I switched into sort of technology investment banking, also not very exciting.
In
But
Tokyo or back in the
in
UK?
London, in London,
Okay.
but these things really gave me the skills and experience that have helped what I'm doing now. And then the third jump was to move to Tokyo and join a Japanese company called DNA doing planning and marketing of new mobile services. And then during that time, I got into IoT and biosensing, and that's really when I came to this whole area. But yeah, I'm based in Tokyo, but I travel to the US a lot. I come to Europe quite a bit now. I'm going to the UK in June, and we see ourselves as global, really. It's just I happen to live in Japan, but I'm not bound to it.
Hmm. I mean, Japan's an amazing place. I used to live in Singapore and would go to Japan once every couple of months to visit one of my favorite clients, and so you and I can share stories about Niseko and all of these places later. But I want to, so the transition, because I didn't know this beforehand. You were in investment banking. There's a lure there of money, fame, riches, whatever you want to call it. Then you jump ship and went into startup land, which I know that feeling as well. Uh, is there any sort of pattern that you had when you went from transitioning these different fields in terms of learning the new field, whether it be IoT, whether it be finance, law, etc., languages? Any patterns there?
Sure. I guess it's like why I made those specific transitions. So
Hmm.
for the investment banking side, I want to do something in business, but especially in the UK, people are a little bit more conservative about career changes. And especially if you're in law, you get a bit pigeonholed in that bracket. So my maths wasn't good enough at the time to do an MBA. I couldn't get through the GMAT, sadly. Um, and uh, investment banking was something that was had some math to it, but also had some of the transactional aspects that I'd done in my legal career. So it's like a more natural bridge, an easier bridge than trying to go straight into a business role.
Hmm.
And I think it was more familiar to me. But the tech bank I got into was pure technology. It wasn't like oil and gas or anything like that. And it was more boutique. So
Hmm.
I got a lot of hands-on experience, and I was doing sector research. So it wasn't like modeling all day, and it was quite a bit of that. But
I know what
really,
that's like.
you know, law taught me about how to write essentially. Banking taught me about how to count and think in terms of numbers. And then the third company was really about thinking about markets and problems and customers. So I'm not someone who I had to unlearn a lot of bad habits. Like if you see my old slides, they're so over detailed.
Hmm.
But really it was about, I think, finding my own passion and purpose and putting, you know, thinking more about what other people want and what they're looking for and what the customer wants rather than, this very detailed and trying to avoid mistakes and having them very carefully planned. perspective that kind of comes from that professional background, which can be a good thing sometimes, but often is a handicap too.
Hmm. Every entrepreneur has that moment where they're like, hey, this is the idea. Let's go forward with it. We'll talk about the name here in a second and the product, but that moment for you, what did it look like? Because it seems very far from life as a lawyer, right? And so how did the idea come about?
Yeah. So I think there are different parts of the genesis. One is that I got really into health and fitness when I was in college. I really liked working out, thinking about food to put in my body. I feel that investing in our health is so important. My own father passed away quite young from prostate cancer after a very long career of working very, very hard, support the family, wonderful guy, but basically he had no retirement. He got his prognosis of the metastasis on his retirement day.
Mm,
So that made me think very hard about doing things with my life while I still can, and also the importance of balance and prevention and taking care of ourselves, stress, good diet, smoking, alcohol, and so on. So that was a big part. I'm not saying, of course, that this product would save his life. That's not what I'm suggesting.
mhm,
The other part was that, you know, I saw that we live in an Asian society, and Japan in some ways is, people still use fax machines in many places, but the other times you can see some of the future, the super Asian society. How can we help people to be healthy and productive as long as possible? It's not even about, US, you have more of an issue about just chronic disease in general. Japan, it's more like longevity and productivity is particularly important. So, how can we, things like blood pressure or kidney function, many people who are in their 60s or 70s have stage 2 kidney disease. It's not at the stage of being treated, but if you're living to 100, as standard in the not too distant future, that's going to become an issue, for example. So
mhm.
um, that made me think a lot. And then I saw that IoT is an area. I mean, there was a lot of hype about IoT. It was a bit like how AI and blockchain used to be a few years ago,
Yeah,
5 or 6
exactly.
years ago. But you had this, Fitbit, saturation of wearable devices, kind of generic wearables. Half of people say quitting after 6 months. But then you had this new little kind of wave of new products that really seemed to help people. So one was like this amazing cuff that went on your arm and it stimulates nerves to relieve pain, for example. Like it's a very simple idea, but there's some people who desperately need that kind of product. Um, and this was, also a really important factor. And then the idea I was actually looking at before I started the company was remote monitoring for elderly care. And after looking at this a while, I realized that lots of people are looking at it. And it sounds really trite to say it, but I was reading the book Zero to One, and
Yeah.
Peter Thiel says, what is the valuable business that no one's building? And I was trying to think about, well, if it's obvious that everyone's doing it, that maybe it's not the best opportunity, right? If there are guys in the US who are very strong on this and so on. So I thought about something that was more widely applicable, and eventually came to this area of, toilet and urine testing. This is
Hmm.
not a new idea. It's actually been around for about 20 years. So I'm not the first person to think about it, and I'll not be the last person. But the approach we ended up bringing to it was definitely new. Really, what we saw was that in this whole area of urine testing, it's an industry that's been around for decades, using conventional chemistry, strips, testing methodology, very patient focused, very disease detection focused. And the people who really get that world are very focused on patients. And the people who are not in the medical world don't necessarily get the science, or they're super in love with the technology, like let's make a whole toilet rather than user experience. So I think what we tried to do is, bring that rigor from the medical world to the consumer world, but have an approach that's about lifestyle change and enhancing health rather than just checking for problems, but with a user experience that can be used everywhere rather than just in one place and at a reasonable cost. And that's how we came to, this.
Hmm. The name Bisu. Earlier you mentioned it's Egyptian. You're going to have to give a backstory there. What does Bisu actually mean?
Sure. So Bisu is the name of the Egyptian god of home and health protection. So
Uh,
you've probably heard of the island Ibiza.
yeah.
Ibiza is an old Phoenician word which means dedicated to Bisu. So the reason is that, Ibiza is a place to think about being a party island, good times and having fun, right? Enjoying life. Um, and Bisu was a god who made evil and disease go away. And because of that, people associated him with good things coming in return. So happiness, having fun. People would tattoo his mark on their bodies, put it in their homes. So he's someone who keeps you safe and makes life enjoyable. We want people to live healthy, happy lives, right?
Hmm.
But the other thing that's interesting about Bisu is in Egypt, all the gods except Bisu had a temple, like a place you would go to worship that god. um so you would go out of your home and then you would visit, and it would be like you go up to see the god, right? But Bisu is different. He actually had no temple. He lived in the home. He was very close to people's lives. So he was very popular. People really felt that he was someone that was there for them and accessible and trustworthy, right? He even has a rattle in his hand to like amuse babies and keep them happy. But the third aspect is that he's the only god in Egypt who's portrayed facing forwards like this, right? All the rest are sideways.
Hmm.
So he was actually a foreigner. He was kind of an imported god into Egypt. So why did we choose this name? Well, Beast is a company that exists to help people live healthier, happier lives. Our product is a device that lives in the home, part of your daily life, um, to try and stop you from getting sick, to optimize your health. And we bring a new approach to this very conventional area of urine diagnostics that hasn't changed for a very long time. So that's why we chose the name. He's also actually, he's kind of both male and female as well. He's both god and demon. He's a slightly curious person, but
Hmm.
we felt that this name was the best representation of what we were trying to do.
Hmm. And what I love about how you presented this at Biohacker Summit is that you presented it with a level of passion that I just didn't expect. And normally I don't like to have technology companies on the show necessarily, but I wanted to
Mm,
talk to you specifically because it was new and it was innovative. But
mm.
how would you actually describe the device itself, or maybe break down the device and the testing strips so that people listening who may have not seen you present it
Mm.
before can do so?
Comes with a stick reader.
Hmm.
It comes with a test stick, and it comes with an app as well.
Hmm.
Okay. So the test stick is what you use to perform your test, right? So normally it comes flat like this.
Hmm.
When you use it, you pop it to a triangle shape like this,
Hmm.
and then you extend it. So on the end here is a pad which absorbs the urine sample. The reason why this is triangular is when it absorbs a sample, it swells up to about 5 times the size. So it
Hmm.
enables you to extend, collect the sample, close it without having to put a cap on the end or anything else, like very simple experience.
Hmm.
And then afterwards, you place the stick on the reader.
Okay.
So the device is recognizing the stick, doing the test for you, sending the information to the phone.
Hmm.
And it's using a technology called microfluidics. It's like a small chip in which the chemistry is happening to give you a high accuracy result with a very small amount of sample and to enable conventional tests to be read in a new way. So what the app
Hmm.
is doing is giving you obviously a result, general overall
Hmm.
wellness score, recommendations, detailed data on each of the biomarkers, and then obviously you've got your trend data, and then your know-how and content and so on. So
We're going to
um,
go into each of these now. A
of course,
question
sure.
for you on the stick: is the stick a one-time use or is it multiple use stick?
It's a single-use stick, so
Hmm.
you could test. Typically, we say twice a week is a good frequency. If you
Hmm.
test first thing in the morning, it correlates well with the last 3 days, 2 to 3 days. If you want to test daily, the evening is the best time. We generally don't recommend during the day.
Hmm.
So um, we're actually working on making the chip inside completely from paper as well. We care a lot about keeping things environmentally friendly.
Hmm.
The device itself you should never have to replace this. It has a very long lifetime. The battery's a very long lifetime as well. But yes, the stick itself is a single use, and it's designed in a way that no urine ever actually goes inside the reader. It all stays on the chip. The chip just sucks the sample in from the pad to the chip and does the test, but it's isolated. So a family can use the same reader, a sports team can use the same reader. This could be mounted to a wall, for example, in a company or a gym. So it makes it quite flexible.
Hmm. Let's get into some of the biomarkers that you monitor, because I know you have the initial biomarkers and you and I have discussed the longer term plan. But in terms of initially, what are some of the things that you're planning to track through urine?
Sure. So the first set, which is a diet test stick, is electrolytes. So sodium, potassium, magnesium, calcium. pH, which is a marker of essentially a proxy for fruit and vegetable intake.
Hmm.
And also it's useful for physical performance because exercise creates a metabolic acidosis, which slows down performance. This in
Hmm.
basic terms. Hydration, and also uric acid.
Hmm.
And lastly, two types of ketone. So um, normal urine test strip is testing one ketone, and
Hmm.
we're testing two types of ketone in urine. So it's a higher quality urine ketone test.
So let's go into the ketone part, because I told you before I'm going to ask this question.
Mm.
Ketone urinary test sticks after the first month historically have become quite useless almost. So why is this different?
Of course. I mean, some people find that after 1 to 2 weeks, depending on how adapted they are. But there are three ketones. There's BHB, ACAC, and acetone.
Hmm.
And acetone you measure on the breath. Essentially, it's a product of acetoacetate. It breaks down.
Colin right here.
Um, BHB you measure from the blood,
Hmm.
and ACAC you measure from the urine. But the reality is that in your blood, there is both BHB and ACAC, and in your urine, there is both BHB and ACAC. What happens is that the longer you are in ketosis, um, BHB as a share of all ketones increases. So ACAC is actually reduced to form BHB, it's converted.
Hmm.
So this BHB shifts and ACAC goes down. And that's the same in the urine. So over time, the amount of ACAC that's circulating and therefore excreted declines.
Hmm.
And that's why after a certain period of time, you see less ACAC in your urine, less ketoacetate. That's why the strips seem to stop working. Also, the classic urine strips have a very, it's got a high detection point. So without wanting to get too technical, it's zero point 0.5 millimoles per liter. And the threshold is about zero
Ah.
point 0.1.
Hmm.
So the test we have is a BHB test at a threshold of zero point 0.1 millimoles, so the same as the renal threshold,
Hmm.
and then the ACAC test. What you see is in prolonged ketosis that BHB goes up and ACAC goes down. So that's a long short of it is you can test earlier than you can with the normal urine ketone test and longer than you normally can as well.
Awesome.
Um, there are some factors that can affect things. So, for example, uh, the ratio between the two ketones changes consistently whether you're in early or late ketosis. But the total, for example, there are some studies that show in people in prolonged ketosis, they actually uh, oxidized or used up fewer ketones as a potential total ketones in long-term ketosis. One thing people say often is that, oh, you have fewer ketones in urine because you're using more ketones. Your body's using the ketones up, so therefore they're less. And that may or may not be true. So there's some situations in which it's true and some situations in which it's not. One factor that affects this is the availability of carbohydrate in the body.
Hmm.
But what always remains consistent is the ratio between these two ketones based on the stage of ketosis. So long story short, we want to give people a non-invasive, high-quality alternative to the blood test. The blood test is fantastic. The breath test is great, but we also want to give you other things at the same time because tracking ketones is important. But where are
Doesn't
my
tell you
ketones at?
everything.
Where are my electrolytes at? Where's my hydration at? With one test, getting as much of the picture as possible.
Hmm. And we'll link, if it's okay with you, to some of these output screens in the show notes. But on the output screens, do you also make dietary? What do the dietary recommendations look like? Because if you're tracking something like pH, that could give you hints as to how much, for instance, either how much somebody's working out. It doesn't give you the full picture, but it also can give you hints as to what types, if are they overeating on protein, for instance.
Yeah. So say, you know, we look at the urine data, but we can also look at the non-urine data. So we're going to provide an Apple Health integration as standard.
Hmm.
And some of the data you can get from that is your exercise data, right? So if you're physically active, we will interpret your pH and hydration readings differently, even your sodium, than if you're not. So if you're going to be um, uh, exercising a lot, you're going to be losing a lot of sodium through your sweat, for example, right? So the
Hmm.
recommendations for the intake and also the ratio of sodium to water are going to be different than if you're more sedentary. Likewise, if you're young versus if you're older, likely to have more blood pressure issues and so on. So we look at the urine data, we look at the activity data, body weight as well. Um, we're looking at the weather data as well. So if you're dehydrated, there could be a number of reasons, right? We try and understand why. So have you been highly physically active? Has the weather been hot? Are there signs, for example, that you've been drinking alcohol? So if your um, pH drops very quickly in response to alcohol intake, and typically urine's darker or more concentrated. So if we're not sure, we'll also ask questions in the app
Okay.
so that we can train the app to understand your particular patterns.
Hmm.
Um, so that's the idea is to, yeah, we look at the test results, but we want to look at things in context. Drinking alcohol can also increase magnesium excretion, for example, regardless of intake. So
Hmm.
there's a matrix of different factors that come together, but we present these things in the simplest way possible.
Hmm. Now, the future. I mean, when I think about the amount of urinary biomarkers out there that you could potentially do, some hormone related, some not. But talk us through kind of where the sort of path is from here,
Mm,
because I mean, you've got a great device potentially coming out later this year. But you can add biomarkers over time. Where do you want to add first?
yeah. So this year is just starting with a diet testic. So it's the electrolytes, ketones, pH, hydration, uric acid. So this can be used for athletes for endurance, improving their endurance, exercise performance, for keto dieters, also for people who want to take better care of their health. Um, and that we're aiming to go on sale around October. So we'll be doing some public beta before then. We're doing some private beta so far.
Mhm.
And
If
that's
you
the
need a
initial
private
sale.
beta, I'm throwing myself out there.
Absolutely. So, I mean, without getting into too much detail, the challenge for us is getting batch production. So we're validating the mass manufacturing method of the chips, and as soon as
Mhm.
that's finished, and then we can move a lot faster. So we're getting closer and closer. We're very excited, but that's the main challenge that we're getting through at the moment.
Mhm.
Um, in terms of the roadmap, so diet test this year, and then this is going to expand from more of an early adopter device to something for the whole family. So we have a number of extra tests that we've got in the pipeline. One is a pet urine test. One is a baby diaper with an embedded removable testic. So people have tried doing diaper testing before, but it doesn't work because when you embed the chemicals directly, firstly, any heat and humidity will damage them or cause an early reaction, and they cannot control. They do not know when the baby actually peed, so they cannot take the measurement at the correct timing.
Mhm.
So this overcomes that. And then the third one is a saliva test for oral health. So you're looking at markers like pH, calcium, phosphate, and blood. Essentially, um, the risk of cavities and erosion, and also signs of gum disease, and
Mhm.
then pregnancy and ovulation, and then those would be sort of the five new testics. And then
Mhm.
based on this data, you can have consultation with the doctor, a dentist, a vet, a personal trainer, um, and if you want to purchase ingredients or medicine or supplements, and also have some community features around that as well. So that's really the plan, to go from diet testing this year to a range of tests for the whole family next year. And ultimately, we'd love to do things like cortisol, testosterone, estrogen. Those are pretty complex tests to do.
Yeah.
It's pretty hard to do it based on the classic measurement method, but yeah, eventually that's the aim.
So there's a number of companies out there right now who
Mm,
are doing you see this quite often in kind of, for instance, genetic testing or some variant of microbiome testing,
mm,
whereby they are taking all of that information and quote unquote prescribing a diet, if you will.
mm,
Well, let's walk through the differences between Bisu and what those classical approaches are,
mm,
because
mm,
I
mm.
think that what you have here is pretty interesting in comparison.
Yeah, so just to be very clear, we don't prescribe the actual meals that you should eat.
Yeah.
This is a very complex area, and people have many different preferences. We're actually more interested in helping diet apps to give you better advice rather than telling you exactly what to eat. So when we make recommendations, we don't recommend meals, we recommend ingredients. Then go
Mhm.
away and make what you like with it. So I won't name the name right now, but there's one particular app we're hoping to have an API integration with, whereby you can enter your diet information in the app, have it pass through to Bisu, you know, recommend based on the data, and then pass you back to the diet app.
Mhm.
So the diet app space is very, very crowded. Diet recommendation space is very, very crowded. But what we're really
Yeah.
saying is these are the things that your body is lacking to reach your, health, weight loss, and performance goals. Let's make a note of those. And now you can tune your diet better than you were doing before. But we're not going to tell you exactly what to eat. Just here are the raw materials. Now go and tweak your diet. That's kind of our approach. The other thing is that we also aware we're moving into a multi-device, multi-data world, right? So I think um, our data could be combined not just with activity, sleep, heart rate, and so on, or glucose monitor data, but there are also companies providing other really good blood testing, microbiome testing, genetic testing services. I think the current state of microbiome and genetic testing data, or at least for diet recommendations, is a bit shaky.
I agree with
So
you.
for genetic
Very much so.
testing, yeah, I think when we have more advanced epigenetic testing, that's going to be a lot more robust.
Mm.
Um, Tim Spector, a professor in the UK, has done some very good research showing that genetic factors had some influence, but it was pretty small compared to the gut biome.
Mhm.
And even in the gut biome space, one really interesting startup called BiomeSense is trying to do toilet-based microbiome analysis. And the reason they started this, the founder is a 20 years plus microbiome researcher, is in the gut health space, it's really hard to get enough clinical data for your study because compliance is really bad. People do not want to keep collecting their poo and sending it in, right?
Yeah.
But the gut biome is changing daily. So he made this startup to get continuous data. So when people are, say, taking a sample, 20 study subjects who provided one or two samples, and then trying to tell you what to eat based on that, it's like, yeah, but no.
Yeah.
So I think in 3 or so years' time, when I think the epigenetics field has matured and guys like BiomeSense have matured, I think there could be a really exciting potential to combine some of these services together to have deeper insights. Like there was one company in Seattle called Araval who sadly closed down last year,
Yeah. That
but they were
was.
really huge pioneers in that space of like
Mhm.
multi-device, multi-data, deep health analysis.
Mhm. And Arabelle is like a very interesting company to me,
Mm,
on many different fronts. And I agree with you. Genetic testing, unless you get one of these ones where you're analyzing multi SNPs, some rant here. What pisses me off
go
about
for it.
it is when you have like a dietary fat recommendation and you're low, medium, or high, and it's based on one SNP. That to me seems very um, asinine in terms of a recommendation. And unless that SNP maybe ApoE, but it still needs to encompass a lot more to me. And I'm looking
Mm,
forward to the day where we're able to not just stack genetics and epigenetics, but also, I mean, some of the stuff going on in metabolomics and what you're doing right now
Oh
is
my God, yeah.
it's fascinating.
Omics is an amazing field. There's one person I'd highly recommend people to look at, Professor Mike Snyder at Stanford.
Yeah.
He's a machine. He's like, not only he's the head of the Center for, I think it's Genomics and Personalized Medicine. He's not only a really advanced multi-omics researcher, so that means like genomics, metabolomics, proteomics, all that stuff together, but he's also like a legit biohacker who applies his own science. So I think he diagnosed his own Lyme disease, like by strapping 7 wearables to his body for like 6 months.
Yeah, he's got this
And
fascinating
he's
quantified
awesome.
self story. It's just he. It's funny because usually when people say a name 2 or 3 times, I'll reach out, and I think this is the third time where Mike Snyder has come up in
Oh yeah.
conversation, and
Oh
so
yeah.
hopefully I'll try and get him on the podcast soon. But this is fascinating. Now, when we look at your device and just kind of integrations, we were talking earlier about feedback loops. First, I would love to hear how the Bisu makes that feedback loop shorter, but plans for integrating with other, you mentioned some of the technologies like Apple Health, for instance, but like other wearables.
Yeah. So with wearable devices, I mean, I use an Oura ring myself, for example.
Me too.
Um, so if you're looking, let's take, for example, someone who's running marathons. So you want to set up your lifestyle and diet to perform at your best. So you need to make sure you're getting the right quality of sleep. You need the right amount of water and electrolytes in the right ratio. You also want to make sure that you have enough fruit and vegetables in your diet, so that, how can I say, um, there is acidity from your diet, and there's acidity generated through exercise. So there's a
Hmm.
dietary acidosis and a metabolic acidosis. Just to be clear, I'm not saying everyone has to be alkaline diet. I don't sell alkaline diet products. I'm not from that school. What I'm saying is your body uses the same substance to buffer or deal with that acidity. It's called bicarbonate. So there's a limited supply in the body. And the more acidity there is in your diet, the less bicarbonate is available to deal with acidity in the muscles. That means muscle firing is impaired more quickly. So long and short of it is, having a good amount of fruit and vegetables in your diet, especially relative to your dietary protein, is going to maximize your physical endurance.
Hmm.
Um, so that's another reason to look at having that biomarker in the right range. And then, of course, how long and how intense is the exercise as well will also be a factor. So I think we can also, by when we're customizing the setup, we're thinking more about also how to improve the onboarding experience. About, okay, yes, you run, but what type of training do you do? Do you do sprints? Do you do long distance, medium distance, and so on? Those could be tailored. But just to be clear on this, um, all the biomarkers we're testing are all known from clinical practice. We're not
Yeah.
claiming to discover any biomarkers that weren't previously known. Some of those we're taking to the wellness side. Some of those are making available in a home context where previously they're not available. Like electrolytes, you can't test them with a conventional urine test strip.
Yeah.
But one thing we don't have right now is like thousands of people's of data to build like really intricate models. Like that will have to come through the beta testing and through the initial launch. So one person we do have a good relationship with is name's Mike Bergeron. He's a leading expert in the hydration sports performance field. And one of the things we will do in the second half of this year is not only doing the beta testing, but actually doing studies to gather, build better data models. So we have enough good research and data to give good key recommendations, but we want to take that to the next level. So just to be clear about where we're at on that.
Have you
Sure.
guys looked at coefficient of variation, for instance, of some of the returns of your on your data points? I'm just kind of curious if that's something you guys are actively tracking.
So I think you're asking me about the objectively verified outcomes of tracking and acting on this data.
Yeah, exactly. So, well, I guess making sure that first the data itself, as you collect it, how accurate is that? Like
Oh,
maybe the
okay,
p values and stuff like that.
absolutely. So for the measurement itself, A classic urine test strip is using a pretty crude measurement where essentially you have the strip and light is reflecting from the surface of the strip and you're measuring the color of that light.
Hmm.
So you do it with a smartphone, for example, or a reader. And that gives you a what's called a qualitative or a semi-quantitative measurement. One of the issues with this is that the reaction starts from the exact point in time that the urine comes into contact with the test strip, and that it has to be measured at an arbitrary cutoff point. So you're basically relying on the user, whether they're being busy or tired or whatever, to every single time get it on point. And the
Hmm.
reality is it's not how it happens. So it's kind of more or less accurate. It's roundabout, but it's not particularly precise. What we do is we don't take pictures of the reaction. We actually take a movie.
Hmm.
So with this chip, the sample is collected on the pad. No reaction actually starts. And when it's sucked inside the chip, we look at the sensors in real time. So we can see that it can get wet. And for each one, we can track the progress of the reaction over time. So it gives you a lot more resolution. It gives you a lot more data points per test.
Hmm.
Um, I don't have the final accuracy data for all the biomarkers right now because we're doing the calibration with this production device.
Hmm.
But I can tell you that we'll be at least as good as a clinical grade analyzer, if not better. So we're not worried about the accuracy part. Basically, you can't mess up the test. Collect a sample, put it on the reader. You can't get the timing wrong. You can't do it too early. You can't do it too late. It's basically taken off your hands. So
Hmm.
that's the least of our worries.
So a traditional test may have a certain amount of variance that taking this movie may eliminate. Is that right?
Yeah. So the important thing to understand is the chemistry itself is not perfect, right?
Okay.
So it's not like wet lab chemistry, reagent A, reagent B. Um, this is something that is good enough to get good quality data in a home context. But when you're using this crude measurement approach, the classic one, it's very, it's quite a wide margin of error. So we reduce that margin of error. But for traditional urine testing, it's not really an issue because generally speaking, you want to see if something is there or not. Like,
Hmm.
do I have glucose in my urine? Okay, I need my doctor to check me. Do I have protein in my urine? Okay, I might have kidney issues. Do I have white blood cells or nitrates? Okay, I might have a urinary tract infection. Like, it's enough to know that something's basically there and roughly how much there is. But
Gotcha.
if you want to make adjustments to your diet, or your training and then see even small changes the next day, you need a finer level of detail. And that's how we spent so much time working on making the technology more accurate.
Hmm. I love the fact that the feedback loops are really short. If you're doing this twice a week, you're already knowing if the changes, you can start to see some of these things,
That's the
right?
whole idea. That's
That's
the whole point.
amazing. That's amazing. Let's go on to CES because you've had a big year so far, my friend. In fact, it's quite a way to launch off the year. You were there. You received some awards. What was it like? What was the feedback you were getting? What was the award itself?
Yeah, it was great. It was great recognition. The award was called the IHS Market Innovation Award. Basically, you went to a media event called Showstoppers where we had a booth, lots of press contacts, and then they had judges going around evaluating the products that were there. They had some prior materials as well, and they chose us in the health and fitness category as the best product in that category. You
Hmm.
know, there are people have different opinions, but I think it's really important for us to raise awareness and kind of get on people's map, and that was a great first step. And having done that, it's made it a lot easier for other people to then cover us, talk about us, share us as well. So that was huge for us. CNET also covered us, one of the top 5 health tracking devices at CES. That makes it easier to approach other media. And I also had some really good meetings with some companies that we're hoping to do some collaborations with on some of the new tactics I mentioned.
Good.
So, and then lastly, we met the guys at Beta, and we're now actually going into Beta stores this month in SF, LA, New York, Austin, and Seattle. So, give it about 2 weeks. We had some delays in China due to the virus,
Hmm.
but you'll be able to actually interact with the device in person and see it. So,
So
yeah,
when I'm
we're very
when I'm
excited.
in Austin, you said LA as well, right?
Yep.
So
LA.
I'll be there in 2 weeks, so I can go and play around with the device.
Absolutely. Please do.
Awesome. Daniel, I want to just, because you mentioned, obviously it's not just you at Bisu, you mentioned your team. How big is the team right now?
So right now we have, I would say, about 6 people.
Mhm.
Myself, CTO, Polish guy. We have a Danish mechanical engineer, Japanese designer, American software engineer. We have a content marketer, and now a digital marketer. So about 6, 7 people. Some
Excellent.
are contractors, but we're growing, and yeah, we're just having a lot of fun right now. So
And the design of the device is quite beautiful. So shout out to your
thank you.
designer on that one.
Yeah,
Uh,
Japanese are great for that.
I'm dating a Korean designer, and she's wonderful with all things design. So, uh, wanted to just transition now into a final few questions.
Mm.
And this has been an absolute pleasure and really a good education on the testing market in general. Uh, for you, what do you do to enhance your focus? Because it seems like you bounced from a few different jobs and now
Mm.
have landed in this area and you have this hyper focus on a very specific goal. What do you do that, to enhance it?
I'm really glad you asked, and it's something I've been thinking about myself more. But when I was in my 20s, I think I was really trying to do everything. I was
Hmm.
trying to fill all my time to be productive all the time. To I had my job, I was working out, I was doing like a sort of a semi startup in the evenings and stuff, and I got a lot done, but I don't think I was particularly happy. And now I actually do less. I still go to the gym. I have my startup. Um, I have my wife; she's wonderful, and I see my friends. So you know, I think I'm focusing on quality rather than quantity of life.
Hmm.
Um, and you know, my sleep is important, but also like every so often I'll have a cigar. Right? It's something I keep in moderation, like once a month. But in terms of like stress, relaxation, have a massage. I think health should be something that is, honest and natural, not neurotic.
Yep.
Um, there are some things where striving for perfection is good, but there are some parts where it doesn't bring happiness. So I think, humans are a bit yin and yang. We're good and we're bad, but overall we're human. So I try and keep the balance in my life about how I behave, and I try not to be politically correct, too politically correct, but I also try to be sensitive at the same time.
Hmm.
I feel really it's about balance. And I was talking to Molly Maloof actually yesterday on a podcast I recorded,
Yeah.
and she's someone who started out as a medical doctor and then moved to being a biohacker, and now is really focusing on a wider message for just healthy living. You know, biohacking being more than just performance, but being about holistic approach to life. I One of the things I like most at the Biohacker Summit is it really had this feeling that it was more than just killing it. It was like we're physical, mental, social, and a little bit spiritual too.
Hmm.
And that I think is a really good way to look at life. So I feel slightly more chill about it, but I think it's actually helped me perform better as a result.
Well said. And I couldn't agree more about the Biohacker Summit aura of it, spelled
Mm,
differently than the company. But like just that essence of working in the spirituality, the nature, all of that stuff is very,
mm,
it's so, because I came into it probably like most people with all these ideas of technology and things and just pushing myself harder and harder. But how to just enjoy is
mm.
very interesting to me. What book has has significantly changed your way of thinking?
Ooh, that's a really good question. So it's not a recent book, but it was the book that actually got me started on this whole journey. And it's called The Second Bounce of the Ball by a guy called Ronald Cohen.
Oh,
And Ronald Cohen is the father of the private equity industry. So not what you necessarily associate with being innovative. And he's quite, how can I say, blue blood.
mhm,
Um, but he people often write books about entrepreneurship and they talk about, this is what you need to do to start a startup. And, here's your lean startup methodology. But he doesn't talk about that. He says, what kind of people are entrepreneurs? What is the kind of person you need to be? And it's like a mirror. Like reading that book is like, do I see things of myself in here? I mean, he's slightly more, how can I say, of the charismatic leader type, but he doesn't overstress that. But when I read this book, my friend gave it to me, it gave me this that first feeling of belief that maybe I could do this too. And then, so the qualities, right? Like in a person. And then the second bounce of the ball is about, it's easy to see where the ball is first going to bounce, but it's hard to know where it's going to bounce next.
Hmm.
And I think this is really the skill of entrepreneurship is you want to be early, but not too early, right?
Yeah.
You want to be the second bounce, not necessarily the third bounce. And, um, you know, I think some things like I've had to learn to be, keep things simple and think more about sales and marketing and engaging. But one thing I always felt is that I could see some kind of trend ahead and try and find that path that isn't obvious, right? Like if something's obvious, it's probably not an opportunity. I
Yeah.
feel the same thing about Japan. Like some people say to me, "Oh, go to Silicon Valley. This is where the innovation happens. You should go to Silicon Valley doing a startup brand." I'm thinking, well, yeah, but if it's so obvious that you should go to Silicon Valley, is it really an opportunity anymore? Like it's very expensive. It's very competitive.
Yeah.
Um, it's its own bubble. But like, um, this is how I try to think about things. And that book for me was, all I can say is if anyone is like curious about doing a startup, it's very easy to get busy with doing,
Hmm.
or even to think about what's my idea, like looking at ideas. And it's true that you should look at problems rather than ideas. But I think the most important thing is to start by looking at yourself, because all a company is a group of people who decide to get together to solve a problem. And how that turns out is really based on who you are. So you should really know yourself, be honest with yourself about who you are as a person, or your flaws and your strengths, and then take it from there. And the company is really, it's an expression of who you are as a person. Like we express ourselves through our work. So I feel that this is a really great book to examine yourself and look at the areas that maybe are strong and the areas that might need work.
Brilliant, my friend. That was extremely well said. You may be biased to this next question, but what about the health world really excites you right now?
I thought you were about to ask about Brexit. So
I was just in London 2 weeks ago, and it just seemed like nothing changed, to be fair. But
yeah,
we can talk about Brexit if you want. We haven't really talked
so
about
good.
that.
Let's come back to the healthcare industry. So
Yeah.
I want to stress first that I'm originally from Britain. I live in Japan. I love living there, but I also love doing business with the US. So anything I say that sounds less than positive about the US is no judgment at all on American people. You guys are fantastic. I wouldn't be doing my startup if it wasn't for the US, most likely, that whole culture. So I'm supremely grateful. But I really feel, firstly, we feel very strongly that our product must be as cheap as possible, because the people who most need our product are not the biohackers, they're not the athletes, they're not the performance enhancers, they're the poor, they're the sick, they're people who don't know how to take care of themselves, who don't have the means. So I think if we made a product that was expensive or was just stuck in that kind of bubble, we really would have failed on what we were trying to achieve. So that's something that's very important. But I feel that, you know, probably the most important innovation that people need in the UK, in the US, is access to healthcare. I often go to medical events where, and especially when I go to medtech events, people talk about improving the quality of care, you know, improving outcomes of patients. But patients for them are the people who are able to pay for the treatment. They're not the people who can't pay. And I very rarely hear people talking about access to healthcare. So I feel that, for um, single payer healthcare is cheaper. I mean, it's
Mhm.
even Yale studies showed that. People obviously should have the chance to have private healthcare as well. I wouldn't destroy that, but that's extremely important. And then I think one potential opportunity for technology could be, could we have telemedicine driven healthcare, right? Like, could we have an insurance program where you pay a monthly premium and I get a Bisu device, I get a CGM, I get a toilet gut biome sensor, I get, a HRV monitor, and I might lack some coverage in other areas, but the focus is really on prevention. And there's a
Hmm.
constant stream of data that's going to a doctor, to a call center, and so on. Like, I feel that could be a really exciting opportunity to make a change, right? Again, it
Yeah,
shouldn't be something where people are going crazy monitoring their data, but um, that's really, really what I feel. I mean, I don't claim to be a deep expert in the healthcare field. It's a complex area. One thing I can say is that there's a very good reason that we're not going to the diabetes market first. One, of course, is that we want to get people before they get to patients, right?
yeah,
But the second is that if you want to build a startup on something that's going to prevent or treat diabetes or other chronic disease, you basically have to show that over at least a year, people who use your product and service have significantly better outcomes compared to people who don't. So you have to make your product and then you have to do like a year of clinical trials at least to validate it. That's like a very high risk proposition.
hmm,
So, and even if you do that, the guys who are like software only, like Armada Health, for example, they're charging like $15-20 a month, and that's software only, and they're just about making margin, right? So I feel that the promise of these devices is great, but the reality for a business in the diabetes area is very difficult.
yeah,
And I believe it will happen eventually. I think we also have a great part to play in like extending healthy life expectancy, healthy aging.
hmm,
Um, but that diabetes healthcare market is very challenging. But the really sad thing is just I had chat with a wonderful doctor. He's a lovely man. He's highly experienced and he's done great work. But like he the idea of prevention just didn't seem to register with him. I was
yeah,
like, well, this device, and he's like, yeah, but you could pair it with this drug. I'm like, yeah, why don't we just stop them taking the drugs? Like, no, but you could have this and this. And it wasn't that he was stupid at all, but I think his framework was so much like, we have patients, we prescribe them drugs. How can we help them take drugs better? Like that's that generation, right? So really, I would probably finish by quoting what Molly said, is that the hope is that doctors can start to prescribe food and lifestyle advice as medicine, right?
yeah,
But most doctors are not dietitians. The one thing I would say is I also feel very strongly that people in the wellness industry really should not bash doctors. Like I see it quite a lot. It's like
yeah,
they lied to us, what your doctor hasn't told you. And it's a bit of sensationalism to sell programs and books and all that stuff. And like, I kind of get it. And there's definitely some truth in that. But people become doctors generally because they want to help people. Like they really
yeah,
do care about helping. So what I most want to see is a marriage between wellness and the medical industry. The medical industry needs more compassion. It needs to look more at prevention. It needs to look more at, you know, before you get to the drug stage, right? The wellness industry needs more rigor. It needs more science. Um, but I think if these two can combine, it will be a wonderful thing. So those are kind of my current thoughts.
I love it. And some of those things, you kind of hear it somewhat being played out, maybe in not as fully as we would like, but like Singapore giving access to Fitbits to citizens. I don't necessarily like the prices that they're charging, but it's a step in the right direction. Or some of the things that are going around on community healthcare that like James Maskell and others are leading in California. It's certainly an exciting time to be alive for an industry that probably needed innovation about 30 years ago. So it's good. Daniel, where can people find out more about you, the device, get in touch, etc.?
Sure. So you can go to our website at www.bisu.bio. That's bisu.bio. You can also send me an email at daniel@bisu.bio. Very happy to talk, answer any questions. If people want to beta test, they can let me know. I can put you on a priority list. And then we have a Facebook page. You can set for Bisu as well. So we have regular progress updates. We have a priority list for the beta. And we'll also be launching a new blog by the end of this month with podcasts, some great content as well. And yeah, we're just very excited to connect with people who are in the space and want to make the most of their health and try out some cool new tech. So
Beautiful. The show notes for this one are decodingsuperhuman.com/Bisu. That's BISU, as Daniel just laid out. But Daniel, this has been an absolute pleasure, man. Like, you took us through the testing industry. You gave us a lot of information here, and I really appreciate your thoughts and candor, frankly. So thank you.
thank you so much for having me. It's been a pleasure.
All the superhumans listening out there, have an epic day.